Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. My today's video is for people who are suffering from this very irritating and debilitating condition called as hemifacial spasms. Very similarly to synkinesis, hemifacial spasm gives you involuntary facial movements. It can impair your quality of life drastically. It can impair your self-confidence drastically. And that's why I thought of talking about it and give you an understanding on what exactly is hemifacial spasm. Definitely I've created one more video a couple of years back on it, but just to refresh the understanding of it, I thought of making this video today. So, what exactly is hemifacial spasm? If we look at the literal meaning of this term, hem means half, facial is face, so which means that one side of the face or half of the face goes into spasm. That's what is the literal meaning of hemifacial spasm. This problem or this condition is characterized by a very typical type of chronic progressive spasms that are experienced on one side of the face. These are of tonic kind, which means that suddenly the face muscles become tight and pull the face in one direction very strongly. And mostly they are irregular in pattern and are seen only on the muscles which are supplied by the facial nerve. Or else you can say these spasms are experienced on the muscles that are responsible for your facial expressions. That's the reason facial paralysis patients sometimes think that they have got hemifacial spasm, and sometimes synkinesis patients feel that they have got hemifacial spasm, and vice versa also happens. That's the reason it is important to understand that hemifacial spasm and synkinesis are two very different things. Most of the time, hemifacial spasm is one-sided. Usually, the onset or else this problem starts around the eyes with mild contraction, and as the condition progresses, the contraction starts becoming severe. This problem has a deep association with stress, which means whenever an individual is in stressful scenario, the spasm, contraction or else the deviation on the face increases. And when the person is in relaxed state, the level of contraction, spasm and deviation reduces. Most of the time, as I said, this is seen on the facial side or else on the facial muscles, but sometimes it also impacts the platysma or else the neck muscle. For few people, this problem, as I said, is seen only in the social scenarios, but few patients also experience the spasms during the sleep, impacting their quality of sleep as well. Now you must be wondering, why does this problem happen? So this has got a vascular origin, or else you can say the problem is with the blood supply. The studies have hypothesized that the blood vessels which are around the facial nerve, in the area where the facial nerve is just leaving your brainstem. Brainstem is the area in the brain from where the facial nerve leaves, is also associate or have a artery next to it. Whenever there is a problem in this vascular supply, it compresses the facial nerve and causes this problem. So, aberrant blood vessels, which means random blood vessels which are present around the region where this facial nerve exists, when compresses the facial nerve, this will elicit a spasm in the face. Now, why does this nerve irritates or compresses the facial nerve only at this? Why this artery irritates or compresses the facial nerve only at this place? Now, this has a structural issues. So, the facial nerve is little thinner, or you can say it's not thin, but the layers which protects the nerve are little less at this area, because there is a change or it's the shift in the structure or it's the property of the facial nerve from this area from where this nerve releases. So, let's not get very deeper into it. But in general, to make you understand, there is a compression that is happening on the facial nerve, which is not continuously happening. Only at certain point it will happen. At that time, a hemifacial spasm would be seen. Why does this happen? Why there is a compression on this facial nerve, or why there is a spasm if there is a compression on this nerve? So there are two theories again behind it. Number one theory says the problem is with peripheral nerve, which means the nerve that has left the brain. In that side of the facial nerve there is a problem. Now whenever there is a compression on this nerve at this area where it has left the brain, there are some unnecessary excitation or contraction of the nerve that happens, which gives this facial spasm. And some of the studies says that this problem is arising from the brain itself. So whenever there is a repeated irritability on the nerve, the brain also gets that stimuli and the brain areas gets hyper excitable to that compression action, which gives facial spasms. Now there are a lot of studies which are still going on to identify what exactly is causing this compression and what is leading to these spasms. Many times people who have got tumors are at higher risk of developing spasms on the face. Now the question arises how a person gets to this diagnosis or comes to know that he has got hemifacial spasm, because there are many other conditions that could look similar to this. Now hemifacial spasm could very similarly mimic with facial synkinesis, can mimic with facial tic, blepharospasm and other conditions. That's why it's important to see a doctor, because he is the right person to rule out and come up with this final diagnosis of what is hemifacial spasm and what is not hemifacial spasm. Some of the important tests that doctor uses to identify this test is number 1, EMG NCV test, number 2, MRI scan, and number 3 is the clinical examination. If we talk about the management of this condition, the major line of management here is the medical management and surgical management. In medical management, there are some muscle relaxants which are given. Apart from that, Botox therapy has been very widely used in order to reduce the symptoms of hemifacial spasm. If we talk about the success rate, surgeries have given better output or better recovery to people with success rate of somewhere around 80 to 88%, where the compression that is happening on the nerve is released by the decompression surgery. From a physiotherapy standpoint, hot fermentation, massage technique and doing a regular facial exercises that helps to maintain relaxation of the facial muscles is the keystone. So if you are someone who is experiencing hemifacial spasm, make sure to take hot fermentation on a regular basis. Make sure to do facial massage on a regular basis and make sure to do meditation on a regular basis, because the compression is on the nerve. You cannot do anything internally, but this internal nerve compression, when it's causing spasm, is hurting your muscles as well. So your muscles are more prone to develop tightness, spasm, more of irritability, which needs to be relaxed down. For that, these 3 practices are very important. So I hope you found this video helpful and informative. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.